No, the federal government is not giving crack pipes to anyone. You may have heard that on social media today and then seen the subsequent statements from concerned lawmakers. Let me explain the facts. Fact, $30 million over the next 3 years in grant money from the Department of Health and Human Services is up for grabs. The goal of that funding, they say, is to help prevent overdose deaths and the health risks associated with drug use. The deadline for states, local, and tribal governments, nonprofits, and behavioral health organizations to apply for that money was Monday. Once granted, that money must be used for what HHS calls harm reduction services. Things like infectious disease testing kits, medication lockboxes, FDA-approved overdose reversal medications, safe sex kits, fentanyl testing strips, syringes to prevent and control the spread of infectious diseases, and safe smoking kits and supplies. And that is where the crack pipe allegation came from. After a concerned Senator, Marsha Blackburn, sent this letter today, the Secretary of Health and Human Services responded, saying specifically, no federal funding will be used directly or through subsequent reimbursement of grantees to put pipes in safe smoking kits. Those kits also must adhere to relevant federal, state, and local laws and regulations. Now, this entire HHS program is controversial. Critics see it as a way to enable drug use, but public health advocates say it's a pragmatic approach to keep an already bad situation from getting worse. The fact is, more than 100,000 people died of a drug overdose last year. If you or someone you know is struggling with drug addiction, there are lots of free resources available, including the free 24/7 national hotline from the Substance Abuse and Mental Health Services. That number is 800-662-HELP. The post office will continue to deliver mail across the U.S. at least 6 days a week, but that move comes with a complete financial overhaul of USPS and what some are calling a little bit of a bailout. So let me explain what's going on. The House just passed a bill to significantly overhaul the United States Postal Service's financial model. Believe it or not, this bill passed with overwhelming bipartisan support. Now it moves to the Senate, where it also has significant bipartisan support. So why is Congress messing with the post office yet again? Well, let's just start with the fact that the post office is in serious financial trouble and has been for years. Back in October in this video, I told you about the Postmaster General's 10-year plan to help USPS get out of debt. To make that happen, he increased prices and slowed down delivery. Then, in this video, way back in 2020, I told you all about how we got here. Spoiler alert. Not all, but most of the problems stem from a 2006 law that requires USPS to prepay for its retirees' healthcare costs 75 years in the future. So how bad is the debt? Well, between the liabilities and the outstanding debts, conservatively, about $100 billion. Now, the bill that passed yesterday wipes out $57 billion of the upcoming obligations USPS was scheduled to make. But the big reform, this bill would eliminate that wild requirement for the post office to pre-fund retiree healthcare benefits and instead require future postal retirees to enroll in Medicare. Lawmakers say this will save the agency another $50 billion over the next decade. The bill will also require mail and packages to continue to be delivered at least 6 days each week. There had been some talk about reducing the number of delivery days to try and save some money. And the bill would require USPS to create a dashboard with performance data so all of us can keep track of what's going on.